Hello, everyone. I'm Dr. Pankaj Lamba, and I'm an ophthalmologist working with Mumbai hospitals. And first and foremost, a big welcome to you all for this interprofessional activity, which Dr. Dixon has thought of. And I think it's a very good way in which we're going to learn more about each other, more about each other professions, and about each other roles in helping the patient to become better. So remember, the patient is always in the center. So just to start off with, so I'm going to speak you as a medical doctor. What do we do? How do we become doctors? And what's our role? And how, as a team member, between me and my staff, the nurses, the physiotherapists, the optometrist, and the pharmacy people, how all we can be together, work as a team, and trust each other and regard each other, so that the patient who is in center is gets better and gets treated. So that's the main essence of what we're going to discuss and learn about today. So let's talk about medical profession. Medical profession, as you know, it's a long cherished profession and very thought of and very noble profession. So we as doctors, once we get into the medical school, we finish our grade 12 and then we get into a medical school. The medical school program for MBBS in various countries ranges from 5 to 6 years. So at GMU, we are following a 5-year-old curriculum in which we have the different phases: phase one, phase two, phase three. The phase one is for the first year, and phase two is for 2 years, and the clinical phase, what we call the phase three, is for again for 2 years. So after we complete this 5 years of MBBS program, we are eligible to do our internship, which is basically practicum, and where we go to different hospitals and gain much more experience. So after we graduate out, basically we become what we call as general practitioners, which would mean that we are able to see all different kind of patients, different variety of patients, and depending upon the patient's problem, either we are able to manage them on our own, or if we think that we can either provide them an initial treatment, we can then refer them to our specialist stage, which is the second stage of being a doctor. So after you finish off finishing our MBBS, we can go in for a residency program in different departments like medicine, surgery, obstetric gynecology, pediatrics, ophthalmology, ENT, even family practice. In different countries, it's of different duration, ranging from 3 years to 5 years. So after we finish our post graduation, we become specialist. So we have a internal medicine specialist, we have a pediatric specialist, we have a obstetrics or specialist in obstetrics. We would have a ophthalmologist, we would have an ENT doctor. So these are basically specialists who have done specialization in one particular field. And if someone is much more enthusiastic, he can go in for a super specialization, what we call as a DM or a doctorate degree in a particular branch. For example, we can have cardiologists, we have nephrologists, we have neurologists, we have cardiothoracic surgeons who operate on the heart, and we have gastrosurgeons who will operate on the stomach. So we have neurosurgeons who do operate on the brain. So we are super specialists in surgeons, and we also have super specialists in medical field. Like we have a cardiologist who looks at the heart. We have respiratory specialists who look at your lungs, to chest diseases. We have specialists of the stomach like gastroenterologist, and we have other departments as well. So people go in for a super specialization if they wish to, and then they become consultants and super specialists. So there are different levels of being a doctor. And if you want to look at different specialists, the medicine doctor would be looking at internal medicine, normal problems like your chest, your lungs, your liver, everything. And the surgeons are the doctors who are going to actually operate upon you, who's going to cut and then um, operate and make the things right. Or we have pediatricians who take care of the children, and we have obstetric gynecology who takes of the female problems. And like me, I'm an ophthalmologist. I take care of the eyes, so eye diseases and eye surgeries and eye laser treatment. So that is our domain of being ophthalmologist. And we have ENT doctors who take care of your throat and neck and nose. So as you see that we have different departments and different diseases, and it's a very broad spectrum, and very wide variety of people, and it's a long program, and we do settle in very late. But the major essence of the whole thing is a doctor is incomplete without the help of all of you. And that's very important. It's all because of teamwork. Remember, we have patients who are in the center, always. For us, or for each one of us healthcare professionals, the patient is in the center. So, whatever we do for the patient care and for the patient health and for the community health. We all are small, small pawns. We would say that it's not that any other specialty is less important. Each one of you is equally important, who plays a very important role. For example, I would say that I'm an ophthalmologist. For me, an optometrist plays an equally important role in patient care. I'll wear the spectacles, I'll wear the contact lenses, but who dispenses it? It's the optometrist. It's sometimes the optometrist who picks up a problem and says, "Oh, you're not getting well, you don't see well, please go and see an ophthalmologist." So it's the part of interrelation, interprofessional care of the patient. Similarly, a orthopedic person will not be able to do very effective practice if we don't have a physiotherapist coming along. I have a frozen shoulder, and I think the physiotherapist would work wonders for me more than what an orthopedic doctor would be. So he's also very important in patient care, long-term patients, physiotherapy. It's a very important part of the process, patient care. So it's all because of teamwork. Nursing. How many of you would feel that without good nursing care, any patient would get better? No one. It's a nurse who takes care of the patient, each and everything. Doctor comes for the morning rounds and goes away. But who takes care of the small, small things of the patient to see whether he has eaten, whether he has been taken care of, whether he has any issues, and if there is, he would respond to it. He would, she or he would then call the doctor. No, nursing care is very important. And in fact, I would say in some stages, nursing care is more important than anything else. So please, all of you understand that we all a big team, and it's very important for us to work together. And that's the main reason why we, at a very early stage of you being in the first year, try to get you together so that you can understand each other, you can understand each other's roles, so that you'll be able to respect each other. And when you become effective team leaders, a doctor for the doctor of the future is not going to be alone. No way. The doctor of the future, the health of the future is all going to be about teamwork. And that is why I'm not using any PowerPoints to explain you, because this is a message which comes from the heart. So you have to understand, you have to learn how to work together, learn together, and respect each other, so that eventually our major goal of the patient care is not affected. So please, dear students, take this as a small little exercise for you to discuss each other roles, to talk about each other innovations, and to support each other in each part of the learning process. Because if we learn together, we will work together. And if we work together, the patient is going to get well soon. And that is our major need of the hour. Thank you very much, and I wish you a very good stay in GMU. And remember that we are all there to support you across different programs in all different ways in the best way we can. Okay. Thank you very much. Please take care and enjoy your journey. Thank you.